Okay, next I'm going to do report. So I'm going to give you a rundown of all of your patients, just as if you were in the hospital and sitting down with one of the nurses on the floor. In room 101 is Angela Wilson. She's a 78-year-old diabetic white female, a patient of Dr. Amby. She was admitted 3 days ago with a fractured right hip, and she has had a total hip replacement. She's a full code except for do not intubate. She has a 20 gauge IV in the left hand, and that is running half normal saline with 20 milliequivalents at 60 milliliters an hour. She's on a sliding scale, insulin as well as her NPH. She just finished her Cleocin post-op antibiotic. Her pain has been well controlled with PRN morphine, 4 milligrams IV push Q4H, and her last dose was 0500. She does have Percocet PRN also ordered, but she has not had any. She's also on Toradol, 15 milligrams IM Q6H with her last dose at 0100. And her blood sugars have been running in the 150 to 250 range. Physical therapy has been in already this morning and has had her up and walking with a walker, and she should be encouraged to do that a couple more times during the shift, definitely with at least one assist, possibly two. In room 102 is Herbert Johnson. He is a 57-year-old African-American male. He was admitted 4 hours ago from the ED with sickle cell crisis. He was diagnosed with sickle cell at age 8 and has had multiple admissions for crises. He's been anxious, irritable, and frustrated due to pain. He is on oxygen 2 liters by nasal cannula. He's a full code. He has a past history of chest pain, so he does have an order for nitroglycerin sublingual every 5 minutes times 3 with a stat EKG and troponin, and to call the doctor if this does occur. He last had 6 milligrams of morphine IV at 0435. He has a 20 gauge IV in the right arm, and that's running normal saline at 250 milliliters an hour currently. That is to drop to 125 milliliters an hour after 4 hours. Let's see, room 103 is George Butler. Mr. Butler is a 53-year-old white male. He has quite a past medical history. He has diabetes type 2, COPD, coronary artery disease, peripheral vascular disease, and he currently has cellulitis of the right leg. Over the past week he noticed some redness and warmth and pain, swelling of the right lower leg, and then yesterday he noticed he had a small wound on the right foot. Called his doctor. Doctor sends him here. He is a smoker, 35 pack years. Let's see what else. He's a patient of Dr. Terhunes. He is a full code. He's on an 1800 calorie 88 diet. He has been placed on vancomycin for his antibiotic, and that's every 12 hours. And let's see, his last time, he is due to have that at 0900. Let's see, he has some inhalers as well, Spiriva and Salmeterol. His blood sugars have been kind of all over the place. He has a tendency to eat things he shouldn't eat, so you have to kind of keep an eye on him about that. And the doctor was in this morning, I believe, to look at the wound, so you better check and make sure he put the dressing on. You never know. In 104, we have Josie Eck, and she's actually not here yet. I understand that she is a trauma, soccer injury, splenic laceration, a mild head injury. She should be coming up at some point this morning, so you can expect her. 105 is Anna Stork. She's a 77-year-old white female, Jehovah's Witness. She was here, if you recall, a few days ago. She's a congestive heart failure patient. She was discharged 3 days ago. couldn't get her furosemide, so she's back again. She is kind of a frequent flyer with that. She also has a history of atrial fibrillation, but we have not seen any of that as yet. She's a full code except not to intubate. She can be up and about, though she does seem to get quite short of breath when she does. She's on a 2-gram sodium diet. She has a saline lock in the left hand. She does have a nitro patch that's put on at night and removed in the morning. She can have oxygen 2 liters by nasal cannula to keep her oxygen level above 90%. Let's see. She's a very nice lady. She does have an allergy to penicillin, but we don't have any antibiotics ordered for her, so that should not be a problem. And I guess that's pretty much it with her. She is on strict INOs, obviously. In room 106 is Maria Lopez. She is not a happy camper. She has a history of Crohn's disease, and she now has a small bowel obstruction. This has occurred once before, and she had a subtotal colectomy done at that time. She has had several episodes of colitis exacerbation with hematochezia in the past. The last one was a year ago. Her colectomy was done in 2006. A lot of family history of Crohn's disease, mother and 6 of her siblings, I believe. No, 2 of her siblings have Crohn's. So she was submitted this morning. She has a distended abdomen, a lot of pain, nausea, vomiting. She is pre-op. She's a full code. She has orders for ondansetron and morphine. Also, she needs to have a Foley catheter placed before surgery, and we also have an order for an NG tube. I do not believe we've gotten that in yet. She last received morphine at 0330 and ondansetron at 0400. And that looks like, oh, she's on D5 half normal saline IV at 100 milliliters an hour. She has a 20 gauge, I believe it's in the right arm. She also has Ancef 1 gram IV on call, one-time dose. 107A is Melba Peterson. This is an 83-year-old white female. She is a patient of Dr. Vidya's. She had a brainstem stroke 2 weeks ago. She was admitted to the medical ICU and has been non-responsive except to painful stimuli since that time. She is awaiting a hospice bed, but ICU needed to have a bed for more critical patients, so they've shifted her down to us. She has a G-tube in place, and she is receiving Gevity by that tube. I understand that her daughter is not happy about this, but unfortunately there is another sibling involved, and that sibling is not here yet. So the doctor refuses to remove that tube until the 2 of them have had a chance to speak. Both of them do have power of attorney and healthcare proxy. Her blood pressure has been all over the place. She does have an order for labetalol if her systolic pressure goes above 180. She last had some at 0400, and at that time her pressure had been up to 192/89. With a labetalol, it did come down to 162/79. She does have a trach in place. She is breathing spontaneously, but she does require suctioning of thick yellow mucus. She needs to be turned every 2 hours. Let's see. I think that's most of her issues right now. And our last patient is 107B. She's our fun one. This is Vivian Gibson. She's a 75-year-old female. She is an Alzheimer's patient of Dr. Newsom's and has been admitted for dehydration. She was in an assisted living facility, and her caregiver noted that she seemed more confused than usual, and noticed also that she had dry mucous membranes and brought her into the ED. She is a do not resuscitate. She has an IV in her, probably a right hand at this point, and it's hard to tell because she keeps pulling them out. She has D5 normal saline with 20 milliequivalents running at 100 milliliters an hour. She can be up with assistance. She has a sitter at the bedside. The sitter has just about had it with her and is anxious for her replacement to show up so she can get out of here. I'm not sure we'll see her back tonight because she's not happy. Miss Gibson also had some acetaminophen at 0200 for a headache, but she seems to have been okay. She's just been up and down all night long. She does have a son, but he lives in another state, so that's not going to help you much. She has an allergy to tape, but paper tape is okay. I think that's pretty much all there is to say. I hope you have a good day.